Let's dive into the discussions shaping the nation.
Minister, I want to genuinely wish you well on your reappointment as Minister, and I think we all need you to succeed in your role. I think to many of us, the decline in mental health of our young people in this country is one of the biggest health, social and indeed economic challenges of our time. We know that the research says that about 50% of us will experience mental health difficulties at a particular point in our lives. But for young people, I think the figures are truly terrifying. And I'm really struck by surveys undertaken by the RCSI in 2021, which found that a quarter of all adolescents described their mental health as bad or very bad. More than a third reported self-harming in their lifetime, and one in 10% attempting suicide. Obviously, some of these results are related to COVID-19 and the pandemic, but we know from talking to teachers and indeed from mental health professionals that those impacts are still being felt in our classrooms and in our communities. And then when we add in the housing crisis, we have this devastating impact on thousands of families out there, and indeed, to my mind, a ticking time bomb in terms of the mental health of so many of our young people. Back in 2019, the Royal College of Physicians of Ireland published research which showed 40% of homeless children experienced clinically significant mental health and behavioural difficulties, were more likely to need clinical care, and were at greater risk of bullying. Now, as we all know, the number of homeless children has gone up dramatically since then, not down. And I know from talking to so many families in my own constituency in Dublin Central, the impact that overcrowding and cramped conditions, the impact of the fear of eviction, and indeed of eviction itself, that is all ravaging a horrible long-term impact on so many children. And that's despite the brilliant efforts of parents and indeed their wider families to try and shield those children from the anxiety of it all. So, Minister, unfortunately it's up to you, to your department, your ministry, to put in place proper provision to deal with the psychological impact of the failures of the previous government and indeed ones before that, in terms of the failure to provide adequate housing and put the services in place to deal with the overall deterioration of mental health services that we have today. Unfortunately, we have currently a system that is under-resourced, overstretched and, to my mind, in need of immediate reform. The wait times are scandalously long. You referred to over 600 earlier. I was doing a quick tot. The figures we had available to August last year, 941 children waiting 12 months or more for a CAMHS appointment. The eligibility criteria for CAMHS is often too narrow. We see that interagency integration and cooperation is indeed piecemeal. I have families whose children whose needs are too great for primary care, but they don't meet the criteria for CAMHS. They are left with nowhere to go, and you know this, Minister, as well as we do here. And behind all that is, to my mind, a model of care that fails to adequately recognise the value and the potential of early intervention. So we all very much recognise the need for better functioning and much better resourced CAMHS, and I absolutely understand and of course support that we have to fix the parts of the broken system that exist in parts of the country. But I think, to my mind, the ball has been taken off. The eye has been taken off the ball with regards over the last few years in terms of ensuring a more comprehensive system of early interventions. And I hear what you're saying with regards to more funding and all of that. But the reality is we're still very far from where we need to be in terms of those early interventions across every county and every community in this country. And because of that, we're condemning young people and their families to unnecessary mental distress and, of course, to mental health situations developing into crises when they could have been prevented. So that means more investment in mental health in schools, in communities and higher education settings, and we absolutely need more investment into community-based mental health services. And I want to pay particular tribute to Jigsaw, to Spun Out and the other range of community-based mental health services who are doing brilliant work across this country, but we need more of that in our communities. Minister, when I look to the breakdown of the mental health budget, and as the new spokesperson on health for the Labour Party, I'm still trying to find my way around it, but when I see that 12.2% or so, it appears, is spent on CAMHS, we don't seem to have any great clarity as to how the rest of the budget is being spent. That needs to change. And with regards to CAMHS itself and to its regulation, I want to just put on the record our very firm and clear support for the mental health bill, to its absolute necessity and urgency, and we urge the Minister to obviously press on with it as fast as possible. We all know that this legislation is badly in need of reform, that it's 24 years old and in need of updating, so we won't be found wanting in terms of trying to progress that legislation through the Houses. But as we all know, that legislative reform will have very limited meaningful impact if our mental health services are not properly staffed. And so I want to very much and sincerely welcome the introduction of the mental health clinical programmes over the last number of years. But the reality, and I don't know whether my figures are as up to date as they should be, but certainly from late last year, we know that we were about 40 teams short across mental health clinical programmes, ADHD, dual diagnosis, early intervention for psychosis and eating disorders. And that points to a series of major issues with regards to how professionals in this area are recruited and retained. And it's an issue that government has failed on right across the health sector. I'm thinking in particular of the psychologist that I met about 6 months ago. She works in one of the biggest mental health providers in the state. She's 55, she's huge experience, but she's burnt out because of the massive waiting lists, because of the enormous toll and strain of knowing day in, day out, she cannot meet the demand that is out there because she operates in a service that is under-resourced. Now, she loves her job. She's totally committed to doing what she wants to what she's done for the past 30 years. She wants to go part-time, though, so she can try and actually save herself, sustainably continue working. And she has been refused that. She's been denied it because the reality of the HSE pay and numbers strategy has imposed an appalling chill effect on any type of flexibility and innovation with regards to managing existing staff. Now, I know that the recruitment restrictions have been lifted in theory, but we're not seeing them in practice, because the Psychiatric Nurses Association have told me today that the 14 posts so firstly, we know that about 700 psychiatric nurse vacancies were effectively wiped out or disappeared because of the pay and numbers strategy. That is wrong. Wrong in a sector where we know that there's huge shortages. But in particular, to a specific example, Lindara, which obviously operates out of Ballyfermot, or Cherry Orchard, they got a derogation in May 2024 for 14 posts. Now, a significant number of those posts have been filled, but there's been no contracts forthcoming. So what is happening here? Because we're being told publicly by the HSE that the recruitment freeze has been lifted, and on the ground we're hearing a very different context. The second key issue I want to raise with regards to recruitment is the Section 39 workers. So we know that the backbone of mental health of services in this country is made up by Section 39 organisations, and they feel a real sense of disrespect because of the lack of pay parity between them and workers who are doing the exact same roles in Section 38 organisations. Now, I very much welcome that the pay negotiations are going to recommence. But I think there is a concern about whether this government is really going to push for pay parity. We saw that Fianna Fáil made a very clear statement that they would pursue pay parity in their manifesto. Fine Gael did the same. It disappeared from the programme for government. Now, I asked the Taoiseach about it earlier, and I asked him, was he committed to pay parity? He said he was, right? But I must say, Minister, I think the Section 39 workers out there need to be convinced of that. We need to ensure that the pay rates of Section 39 workers are tied to the pay of Section 38 workers, and we don't have this nonsense that happens every few years that a pay negotiation has to happen to let Section 39 workers catch up. Because the reality is that we've got care workers at the moment doing overnight shifts who are earning less than the minimum wage. So I ask you, Minister, to very much put your political heft behind ensuring that those Section 39 workers are given the dignity and the respect for the really crucial work that they undertake, because we need every single mental health worker out there to stay in their jobs, to be looked after. We cannot afford the exodus that we are seeing in so many parts of our health sector with regards to recruitment and retention.
Thank you, Deputy. And now we have a government.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.